My name is Rabbi Gadi Levy. I'm a Mohel, a specialist in the field of circumcision, and have been practicing for the past 15 years. What I want to talk about over here is healing after circumcision. What's the deal with the yellow stuff? Is the yellow stuff healthy or is it unhealthy? And let's just talk a little bit about that. Okay, so what I have over here is my diagram. Over here, we have someone who is uncircumcised, and we have the foreskin coming up over the top and coming back down. Over here, we have someone who's already been circumcised, where the foreskin comes up and attaches at the inner layer, and there's this natural scar where the two layers attach. Okay, so now, what is typical after circumcision, which is primarily the first 48 hours after circumcision, is to find a little bit of white, which is a little bit of pus. I wouldn't call it pus, a little bit of scarring around the head, and also along this scab. Okay, this scab between the inner layer and the outer layer of the foreskin is typically where one would find some we'll call it yellow stuff, which really is just a wet scab of the body that is healing. Now, that is completely normal. That's completely natural, and basically it's a miraculous, beautiful thing. The way the human being was designed is that these two layers, especially on a newborn, these two layers, they attach themselves to each other and they scab together with this wet scab. And that is the yellow stuff that someone may find after the circumcision. However, if you're about 7 to 10 days after circumcision and you start seeing yellow stuff, it's most likely pus and is often caused by infection. And infection is really bacteria that has been able to attach itself to live parts of the body and are able to penetrate and cause chaos in the body. So what one needs to do or deal with right then and there is to ensure that get some antibiotic cream that one would put on that area. Typically, A and D cream has antibiotic properties. Bacitracin will have antibiotic properties. So put that on the area, and then obviously if it doesn't clear up within 24, 48 hours, make sure to get your son seen by a medical professional. So once again, initially, over the first 48 hours, it's natural to see a little bit of pus, a little bit of scabbing that develops both on the head and also along the ridge. Not the ridge, but along the attachment of the two layers of skin. If you start seeing pus later on, meaning 7 days to 10 days afterwards, it's most likely an infection, and you want to get that seen by a medical professional and make sure get yourself some antibiotic cream on that. Feel free to reach out to me on my website, myhomecircumcision.com. I look forward to being in touch.